So welcome to Matt Maneri Interviews. Today I have Aaron Ali Shaikh on the air. This is May 16th, 2020. We're in the middle of a pandemic. And I knew Aaron when he was in New York, being a young saxophonist extraordinaire. And now I find out he's a doctor fighting on the front lines in Cleveland. So I really wanted to talk to him because he wrote something very moving on Facebook about a month ago, I think it was. Was that right?
Yeah,
So can you talk a little bit about what you wrote and what you were talking about?
sure. So I mean, the objective of the letter, well, let's say the intended audience ostensibly was other healthcare professionals, but it was an open letter, so everybody could read it, and I think it would resonate with many people who were concerned about generally what was happening with, I guess, our overall national, local, even state response to the pandemic in terms of, the preparation with like PPE, testing, health disparities, as we've learned that the disease is affecting people of color more disproportionately, and with all of those things in mind, and and at that point, and I think still at this point, and the point will probably return once we may see another spike in disease, that healthcare professionals are pretty much on the front lines have been deemed, I think, appropriately, quote, heroes, not necessarily myself included, but and with that position of heroes and being on the front line, much as like veterans were when they were fighting, is that we had a position where we could leverage that to call for certain change within healthcare and also within the government. Primarily, more testing, more PPE, but just better leadership and overall restructuring of healthcare in the sense that we would put more of an emphasis on public health, which has been sort of, I think, put to the wayside in the last 30, 40 years, probably. And basically the pandemic is, the underlying assumption in my mind is that when people get sick, they'll come to the hospital and nurses and doctors and respiratory therapists will take care of them. That's just the assumption. So if we get sick, they're there. And with that being said, I mean, we should have some say, and we could have some say in how the response is and how the country is kind of run going forward, because hell, we're the kind of been buttressing this whole system, I think, for the last 3-4 months, and pretty much for the last in the healthcare system is just assumed it'll be there for everybody, whether they can afford it or not. At least it's there.
Right.
I don't know if that's clear.
It's clear. And you're living in Cleveland now, is that correct?
Indeed, yes.
That's the backdrop behind you. Okay, so
Yeah.
Have you seen any change, any momentum towards fixing these, loose ends?
So, I mean, I'll be, it hasn't been like New York or Boston or like,
Right.
Detroit or New Louisiana. Here, Cleveland's in the position where we had a governor that locked down pretty early, and we have a lot of hospitals here, a lot of beds, a lot of capacity, and we didn't really see a crazy spike. But I have seen a lot of change in terms of the way that we were ready to ramp up. We ramped up pretty quickly in the sense that we needed it, like with like extra hospitals. Those were opened up within a week or two, and we had lots of PPE that was procured for our healthcare workers, and generally, just clinically speaking, the doctors and the nurses and the researchers in Cleveland especially put in a lot of good like clinical protocols, which is kind of the nitty gritty of treating the disease, especially amongst the critically ill. But there's a lot of thought put into how to treat these patients, which hasn't really been talked a lot in the news that much, save like Trump with hydroxychloroquine or remdesivir, but just how to treat people with like the blood clots, and it's a pretty complex disease.
Could you
I've seen that change in advance in like just treatment.
Could you extend that a little bit, because I haven't heard exactly how different treatments are being used at all. Like that's something that's not on the news at all. Can you talk about that a little bit?
Well, I mean, it really depends on whether you have like mild or moderate or severe disease. mild disease is anywhere from asymptomatic, and these are people who are been tested and positive, to generally shortness of breath, kind of like flu-like symptoms that we heard about initially, to moderate being people who probably need to be admitted to the hospital but not to the ICU and be monitored, people in the ICU. And the treatment in the ICU is, sorry, there's a lot of sirens in the background.
That's okay.
The treatment in the ICU consists of a lot of oxygen, ventilators that we hear people being intubated, and just the sequela of the disease is it affects the lungs. People can have strokes, so we have to deal with that. People have, it affects their kidneys, so people end up on dialysis, and lots of blood clots, so people are having problems like losing limbs. Sorry. A lot of hospitals here, a lot of ambulances.
It makes it more exciting, honestly.
Yeah. I was going over the bridge there. Oh, actually, there's a bridge down here below me. Sorry, look that past. So basically, it's what we call multi-organ failure. Several organs fail, and that's a damning kind of situation for a patient. Brain, heart, lungs, kidneys, skin, blood vessels, all of the things. And so the way that we treat is with lots of blood thinning if they need it, dialysis, a lot of support, breathing through the ventilator. And then we have a few medications that have some limited efficacy with some patients, not all. There's one that we heard about in the news, remdesivir, that's working. There's another one that Trump was talking about, hydroxychloroquine, that doesn't really work.
Right.
But, so we don't have a lot of medications. We just have a lot of support, and hopefully the immune system can tackle the disease once and for all.
Well, look at you. How did you get to this place where, like, when I first met you, you were playing microtonal shit on your horn, and now you're talking about efficacy and this and that. Let's go back. We'll get back to the COVID-19 stuff, but you grew up in Cleveland, is that correct?
I did, yeah. I grew up west side suburb of Cleveland, and then and then I don't know. My mom pushed me to play an instrument, so I started piano, which I didn't really stick with. And somehow I found the saxophone, and then got into jazz. And then I went to the new school, for undergrad.
Do you remember what got you into jazz?
I think oddly enough, I think I heard like John Coltrane and NPR or something in the morning. They were playing, I think it was like, what's that, Grand Central? Is that it? Or Central Park West, rather.
Central Park West.
I think I heard that tune, and I really liked, the sound, and then there were some musicians around here that I met who were already playing jazz, and I studied fundamentals of saxophone with them, and then they got me more into jazz, and it just sort of went from there, and I started playing.
And were you a part of the Cleveland scene? Did you know Harvey Pekar, or was that a little bit before your time?
So I knew Harvey, man. I met him. Well, I don't think I ever met him in person. I talked to him on the phone for like 4 hours one day while in a practice.
That's Harvey, yeah.
Yeah. My phone ran out of batteries, as a matter of fact. I was talking to him, but I was like, I think he wanted to talk to me because there's a guy, Chris Jonas, who was he's a soprano saxophone composer, who was doing a large ensemble here in Cleveland, and I was coming back to play in that, and Harvey just wanted to do a story on it, so he called everybody, I think, in the 10-person ensemble, and talked to them probably for no less than 4 hours. So I just happened to be one of them. So I met him that way, just over the phone.
Yeah, he was a good friend of my father. I don't know if you know.
Absolutely.
But, they became very tight, and they would have 4-hour conversations 3 times a week for months on end.
Yeah. Yeah, I remember talking to him about your dad, because I'd already been into your music by that point. And I think he was like, I remember talking extensively about Wynton Marsalis and your dad.
Right.
So that was an
interesting combination. Yeah.
Yeah, I thought so too.
So you got into jazz, but was the doctor thing always kind of in your line of sight as well, or is that something that came later?
That came later. My dad's a doctor, was retired now. He's still a doctor, cardiologist. So that's always sort of been around in my family. A lot of being half South Asian, there's a lot of doctors and engineers on that side of it. So it was always around, and my interest was sort of in the background with it.
Mhm.
And so I don't know, at some point it just sort of reared its head through, and you can't just, you can't just pick it up. You have to kind of do it. You have to go all the way through. You can't just, fortunately, no way.
Yeah. So you got into jazz, you start playing, you decide to go to New School University in New York City. Is that correct?
Yeah. Yeah, exactly. Yeah.
And that's kind of where I met you, right?
You probably don't remember this. I did meet you in Cleveland once. You did a tour. It was a quartet with Bar Phillips.
Oh, with Randy and
Yeah,
my father, right?
and your father. I met you outside of actually the same place I played with Chris Jonas. And I don't remember this guy Walt Mahalovic, who is like did a lot of like Eastern European music. I think he opened up for you guys.
Okay.
But I met you outside of that. Not that you should remember that. And I was like probably 17 or 16 or 17. But
It's
then
a
we
while
met
ago,
in
but
New York.
I do remember that tour, and I do remember I was driving the van the whole time, going through America and Canada, and Bar Phillips is fortunately still with us. My father's not, but even back then they were still elderly men, and the amount of pee breaks we had to take on the road. I guess as your prostate gets older, you just have to stop more often. I just remember having to kind of add an extra hour to every trip for like, okay, we got to stop every like half hour kind of thing. One of them has to pee soon.
Wasn't it like a tragic van breakdown on that tour?
I wouldn't be surprised if
Yeah,
there
like in
was.
Buffalo or something.
I'm sure I blocked it out of my mind. I'm sure
You
I
know
did.
who booked that show was Josh Smith, the guy from Birth, with Joe Tomino, the drummer, and Jeremy Blake, the bass player. They're a guy from
Right.
Cleveland. They booked that show and they opened for you. That's what I remember. That's who opened
Okay.
for you.
And in addition to being a musician, you also dabbled in booking a lot of things, right? And promoting shows. Is that correct?
Yeah.
Or you
Jack,
still do as well?
I don't anymore. I don't have time, and it's not the same in Cleveland as it is in New York. Although New York's not the same as it was 3 months ago, unfortunately, sadly. Yeah, Jackson Moore is another saxophonist, and I put on this thing called the New Languages Festival that I think you played it once or twice. I played a lot with Randy there.
Right.
But yeah, we did like an annual festival, and then like throughout the year we do a couple of like I don't know, like series. And it went on I think from like 2006 to 2010. Some of them were bigger, some of them were smaller. In New York, we played in like Brooklyn, and then a couple of shows. A couple of them were like the Living Theater downtown.
Mm-hmm.
Back when that was still around. I don't know if it is anymore.
I don't know. Yeah.
Yeah, a lot of cats played at that.
So I've been to many New York City free health clinics because my health insurance has been up and down over the years. And I've noticed all the doctors I talk to, these young doctors, like usually teaching schools, and they're very young and being trained, and they're all musicians, all of them.
Really?
But yeah, or at least 90% of them. But they're all coming out of a classical tradition. They're like, oh, I played piano and this and that, or violin, and I did this repertoire. And they're all very high level. I haven't heard of many free jazz musicians going into the medical field. So I want to get this perspective. Can you
Neither
enlighten me a little bit? Yeah, no.
A lot of we have like an opera vocalist, and I don't know. I think there's like a couple of violinists, who are in my medical school class, but nobody's like nobody's like playing jazz in that regard that I know of or had been.
Right. Do you find a connection between improvisation and medicine at all, or is there any kind of benefit to you studying medicine that came from improvisation?
Probably. It's likely ineffable, man. I don't really know how to describe it other than there's something that, in jazz with improvisation, you're constantly having to, at your best, you're thinking on several, feeling, I don't know, whatever, on several levels and several different ways at the same time. And in medicine, you definitely have to be sensitive, and what a patient's telling you, you kind of have to be listening, but thinking about a lot of different things at once, a little more cerebral in that regard. But the best doctors kind of reflect a lot of the best musicians that I had a chance to study or work with, where like they're kind of thinking on, or at least understanding something and feeling it on several levels, and surprising me with their thoughts of what they think is going on after we're done talking to the patient, examining them. Their novel approaches to using very simple interventions that I wouldn't have thought of in terms of treating people. Sort of like in music, it's like it's just putting the right note in the right spot, as Randy would always say. And with medicine, it's just like just doing just enough, and less is often better than more. But I guess, yeah, there's a lot of improvisation, and the other thing that I like about music is it's interpersonal. Whether you're playing solo, but you always have to deal with people, and and a lot of that taught me a lot, and I think that I can see that lacking in some other, not all, but some other doctors. I should take that back. It's only helped me going forward. You know, like learning that kind of that experience of working in a band and then like with a group of people to make something that's a whole. I find that to be valuable too.
Absolutely. So, New School, can you talk about that experience? Was it a good experience? Is like music and academia helpful? Like obviously when you study to be a doctor, you need to go to like classes and things and really learn this stuff. Is it the same with music? I've often wondered, because sometimes I think it's all a waste of time and you just like learn by doing, but can you talk about that a little bit?
That's why I like the New School, because a lot of people, like a school that like a lot of people didn't finish was probably a good school to me, you know. It's like a lot of people got better and they left, and but yeah, the New School is one of those schools that you could kind of like just, you could go and do, anybody if they wanted to could pass the classes, but you didn't really, you could forge your own path through it, you know. You didn't, like, if you wanted to do bebop, that's probably the best thing. If you wanted to be a bebop musician, you probably learned the most in the New School. If you just wanted to live downtown in New York and have a reason to be there, then that also could, the New School was good for that too. For me, I chose like probably the most expensive and worst path is in a quote unquote, I'd free jazz. I mean, there weren't any really classes there at the time. Mark Dresser ended up teaching me a class, but like there weren't, like, there's no classes, and really they didn't teach me anything. They didn't teach me like the real stuff you need to know anyways, and maybe I never learned it to begin with. But it was a good, I got to study with you a couple times. I studied with I studied with Randy for like 4 years, you know. Those are the things I took away from it, not any necessarily the classroom experience or even like that. And they had some cool concerts, and I met a lot of like Andrew Surreal, a lot of great musicians just by being there. The access to those legends was great. Reggie Workman, all those guys.
Right. Access is a lot to do with it. They do have a great community of people there. I'm not poo-pooing on New School or any school for that matter. But sometimes I think in music, I often wonder like what it means to study as opposed to like maybe just having a mentor and just kind of getting out there and playing with people and like learning via mistakes, you know?
That would be the best. I mean, if you could like, if instead of like sending your kid to school for a degree, if they really, really like theoretically really want to be a musician, give them the same amount of cash it is for tuition, or give them the same loan, and let them choose their mentor and just like play, you know?
Yeah.
So if you really purely think they're going to be a jazz musician or a musician, just like go and mentor, like, you know, that'd be, and like live in New York, you know, that would be the best way to do it.
Yeah.
Because you can learn all that stuff. If you want to learn how to like arrange for big band, you can learn that with whoever is out there.
Absolutely.
That's one thing the New School was cool with. They let you study with whoever you wanted, and they would pay, you know, your tuition.
No, they're very cool that way. Absolutely. You know, you said you studied with Randy Peterson, who, of course, is a colleague and friend of mine. But I've learned from him more from him than any other educational place, maybe other than, you know, via osmosis through my father and studied the violin through Robert Koff. But the overall kind of ideology that we came up with, it really was like these hours I spent with Randy Peterson, just kind of shedding these ideas, you know, that I found the most beneficial, more beneficial than any kind of classroom could ever offer, you know.
I absolutely agree. In my experience, although mine's not nearly as deep as yours, for sure.
What made you want to study with Randy? Because you're a saxophonist, and it's an odd choice maybe to choose a drummer to kind of be your guy at New School.
Well, first off, I really dug your guys', if that's a word. I really dug your guys' music, so that was number one. I think I don't know exactly when I first started talking to Randy, but as you know, when you start talking to Randy, I'll talk to you for a while, you know, and that's, I don't mean that as a bad thing.
No.
And I was impressed by the way that he described improvisation and music, and there seemed like there was a lot to learn there. And and you know, it transcended his instrument, although he is a drummer at the core for sure. But I just, the way that he talked about music, and then the way that he made me think about it, and the way that I could approach it, and then we would have lessons where we'd have an hour and a half lesson, hour lesson. We'd maybe play for 3.5 seconds, you know, and then we were both sitting at our instruments and he'd talk.
Yeah.
Both 3.5 seconds sometimes.
I think that's why Randy and I, when we were doing our stuff, we actually had 12-hour sessions. We'd be in the basement here in this house, actually, that I'm in right now. We'd literally be in the basement of this house and be down there for about 12 hours to maybe play about an hour. And the 11 hours was just talking about it.
I was always curious, like, in that regard, like how, you know, how your dad, like what the dynamic was between those two, because Randy more than admires your dad, but I don't never like how your dad listened to him or how they talked together, because that's not something I ever really saw at concerts or backstage or off stage.
Yeah, that's curious. I think Randy and I had spent so much time kind of developing stuff. When my father came into it, we actually invited him. And he was a little bit reluctant. It's like, no, you guys are doing your thing. This is cool, you know. We finally got him to come downstairs, and immediately just kind of worked, of course, you know. But the way Joe talked about it via Randy, you know, versus Randy was very different, obviously. Joe was more kind of the, what's the word? You know, like gung-ho, like we're going to change the universe, you know, like kind of like uplifting, you know, like we got it, this is it, you know. On the other hand, Joe would put us through these torturous exercises because we started developing ways to play that we knew worked very well. Okay, this works, that works, blah, blah, blah. So then my father, on purpose, would like play something that would be almost impossible to play with. And we'd be like, you know, I'd be like, come on, Dad. Or Randy would be like, I don't know what to do with this, you know. And my father would be like, well, if you can't work with this, then you're not an improviser. You're like he would force us into these situations, like playing the worst kind of thing that like, or switch it, like just when we're into a really great thing, he'd switch it and be like, and like, if you can't make that work, you're not an improviser, you know. And that was a very big lesson for us, I think. So they were very different. My father was a little bit more action oriented. Randy's very kind of thoughtful and talks about it for hours. But they got along great for the most part. And, you know, they respected each other so very, very much.
Sure.
So you started New School, you started doing gigs, you started promoting some shows in Williamsburg as well. Is that true?
Yeah.
So you're playing music. And what do you think? Is this a career? Are you thinking this is my career?
Oh, what, medicine?
No, playing music and
Oh, wow. Oh, at that time, sorry.
Yeah.
Yeah, I thought so. I mean, I wasn't really sure. I didn't really sure what a career in music was.
I'm still not.
I don't think that it doesn't exist. I just didn't know what it would look like. It looked different for everybody. I mean, I looked at people, you know, who were more like established. Well, you guys were there, and then people like Tim Byrne or Mark Dresser, those guys who were like,
Sure.
Some of them had gotten into academia, some of them were constantly touring, constantly recording, seemed to have relatively stable lives. Not that when I was 20 years old, I was thinking about stability, but I was looking for at least some sort of template to you know, and and then I realized it wasn't really one. You just kind of made it yourself, and that was cool. But I don't know if I was like, I didn't know how to like get to Europe or anything, and on a tour. And I also like got to the point where it was like, do I want to have a career in music? And if the answer is yes, then how do I want to do it? And I just kind of wanted to play music for it, just to play. I didn't really want to like, I didn't want to like call it work.
Right.
So that's when I got to a point where I was like, well, maybe I'm not good enough, or maybe I don't have it. It's not in me, or maybe I've already done some of the things I've wanted to do with music, and I just want to enjoy it as part of my life, as it is now, and let that grow on its own rather than use it for income. And so I started thinking about other things, and I had other interests otherwise, you know. But at the time, leaving, you know, 2004 or 6, whenever I left the music school, I had every intention of, you know, trying to grow that career.
Okay.
For some time.
And so you also, Randy was saying that you opened a bar, is that correct? Or you were part of a bar?
Yeah.
In Williamsburg? Or is that untrue completely?
No, that's totally true. That was open for 6 years. That was actually down the street from Randy's house, which was another plus of living in New York. It's always around somebody, you know, and Randy's a good person to be around. So that was in Williamsburg. It was called The Drink. It was open from like 2010 to 2017.
Mm-hmm.
And it was on Grand Street. It was on Manhattan and Grand in Williamsburg. And it was like a kind of a neighborhood bar. We had a lot of music, some music there, but just a lot of rabble rousing, you know. I'm drinking there for sure.
So while you're doing that, the turn comes to the medical profession. What initiated that specifically?
Yeah, so in between like graduating from the new school and going to medical school, I went to social work school, and that's a whole nother story. But that was actually during the time that I came up. Last time I was at the house you're at now is when your dad got the honorary doctorate.
Okay, so
I was in social work school at the time, maybe 2009. Yeah,
he died a few months later after that, actually. Yeah. So came just in time.
So I was in social work school at that time, but the reason why I did that is because being a nerd, I passed through like all those foundation classes in music school, like theory or whatever. I can't remember. I don't know, like ear training. I passed through a lot of the prerequisites, so I was gonna graduate from the new school early. So I took on a second degree of psychology. I just chose one, and from there I got interested in like maybe becoming a psychoanalyst. I thought it would be interesting, and so social work school allowed me to do psychotherapy. So I went to social work school. When I finished social work school, realized I didn't want to do any of that, but I wanted to still work with quote clinical stuff. So I went to med school. That's sort of the gap. It kind of led from like one side interest to another side interest to oh shit, this is going to take up all my time.
And what was the catalyst to make you say, like, I'm committing to this? This is what I'm going to do.
I think it was probably failing my first calculus class, or almost failing. I was like, well, I'm gonna do this one. I'm gonna show that professor, and then so I just once you keep it's getting in a medical school to pass. You know, you just start the classes, and it has an inevitable end of passing medical school, and then residency has an inevitable end of finishing and going off and practicing medicine. So it kind of was. That maybe that path that was clear that I never really saw for me in music. Maybe that was it. I don't know. I never really thought about it that way, but perhaps that's why I like medicine, because it's like, even if it was 10 years of work, 2009 to 2019, and I still have another 3 years, at least, some more than that, at least I had a direction that I was going to go. And within that, I could have fun in all of that, you know. It gave me an excuse to remain a student too, which is always a good thing.
In music, we find mentors or people we like. I can tell, I never really talked to you about it, but I can tell by your playing. I'm sure we did talk about it a little bit, but that you like my father's playing. Because when I heard you play, I've watched some stuff on YouTube recently, you were definitely influenced by my father, correct? Is that correct?
That's an understatement for sure.
Okay, so I was wondering, because I know very little bit about medical school and medicine and all that. Are there people like that, mentors in that field that you kind of look up to and like, wow, that guy's empathy is amazing. I want to learn to do that, or is there some people that you just kind of like gravitate towards? Is there a similar kind of mentor student kind of, relationship in those kind of fields?
Yeah, medicine's a lot like that with music, where there's a lot of mentoring that happens, and it's a really important part of it. Nobody is nearly as to use the word superlative, to use any superlatives here would be underestimating. Nobody's been nearly as powerful as the music that you guys play, and nobody's been nearly as powerful of an influence as your dad has been. And I don't think could be, which is, and I'm still understating that. But yes, there's things that have been analogs to that, but nothing as to the degree, just because of his presence. But in medicine, to answer your question indirectly, there have been some attendings. We call them our attendings, are like the head doctors, who have definitely people who I've gravitated towards for sure.
Is there anybody in particular you want to shout out to?
There's one. Yeah, well, I mean, I can't. It's hard to single a lot of people out, but there's one guy who had a big influence on me in residency. He's a cardiologist. He helped with some right in my notes. This guy, his name's Dr. Josephson. He was a great cardiologist, great thinker, hilarious guy. He's also from Brooklyn, for that matter. So he kind of has that like, I think like Bensonhurst or Bay Ridge or something. So he kind of has that going on. He knows about all that kind of like that world in that regard.
I totally know that swagger.
Him and I got for sure the swagger. Yeah. So yeah, he has that. So I dug him, and he's like one of the most supportive guys in the program for sure, and super brilliant. But yeah, man.
So you started studying medicine, and then you kind of have to discover for yourself which direction you want to take it. If you want to like be a specialist in this or that.
Yeah.
What path did you take, and tell me why you did?
So medical school, like when you're done, there's one first major split. You either go into surgery, or you become a surgeon, or you become a physician. So I know what you call all doctors physicians, but in medicine, you either go into surgery and become a surgeon, or you do non-surgical stuff. Physicians are people who are like your primary care doctor, or pediatricians, or lung doctors, kidney doctors. So I went into the physician side. What made me choose that is I'm not very good. I don't want to tie knots. I don't like the OR. My dad's a physician. And then when you're going, so I went into internal medicine, which sort of the ones who prescribe medications rather than their intervention is not, instead of using the knife, they use medicine, okay? Mm-hmm. Does that make sense? And so I sort of like that. It's a little more cerebral for me, at least. And then from that direction, you choose what system you want to, internal medicine, what system you want to treat. The lungs, the kidney, the heart, rheumatology. I chose the heart. Also, I have a family background in that, and I just thought the physiology and the medications, and there's a lot of interventions you can do that are non-surgical that work. And one of the most famous studies that in medicine, and especially in cardiology, that I always have to read about, and was really well done. Actually, it's called the Framingham study, where you're from. And I wonder if any of your family was in it. Yeah, it's like one of the biggest studies ever in medicine.
I did hear about this study. No, I actually asked my mother, because I thought maybe somebody would have been in it, but we haven't been in that. But I've heard about this. Do tell.
Yeah, well, it's just all the reasons that we know why people have heart attacks, high cholesterol, risk factors like obesity, all those things, drinking that we're doing here, all those things, a lot of those were elucidated in the Framingham study, and it's still going on. And it's probably because I think, Framingham's near Boston and all the universities are there. I think that's why they chose that town. So relatively like, I don't know Framingham, but I think it's one time it's probably a very characteristic suburb or something like that. I don't know why they chose.
I think at the time it was. Yeah, It's a very big town. It was always called the biggest town in America. And now it's officially a city. They voted that in a couple of years ago, by the way, because it's so big. But yeah, it's got a nice cross section of pretty much a lot of different things going on here. So in that sense,
Yeah, yeah. So I don't know why they chose the town, but that's why I think that's what they did. I have no idea. I never listened to that. But anyway, that's where that's kind of how I got there. So my next step after my internal medicine residency, which I'll end next month, I'm gonna go into cardiology, which is a fellowship, which trains me to be a subspecialist in just dealing with medications in the heart,
okay,
treating heart disease, not surgery, heart disease.
okay. Is this exciting to you, or is it more of a, I think this is what I'm good at, or like I always wonder what motivates people to do certain things. Like, are you excited about like I'm going to treat people's hearts in this way, and this is this is the balls, like
Yeah, there's some of that. There's some of like, this is a challenge. Let's see if I can actually do it. Another one is like, it's more stuff to learn, which I like to do,
yeah,
and it's, it's more, I like to treat patients. It's everybody likes their cardiologist in general. So in that regard, it's a good kind of doctor to be, I don't know. It just seemed like, it seemed like the area of medicine that seemed the most amenable to me, probably because, for one, that doctor I talked about earlier, and two, family history with my dad, and three, just like, it's a pretty competitive field where there's a lot of research and everybody's trying to do a lot. And so there's a
right.
lot for me to be able to get into a lot of different areas. I can go with cardiology. It's versatile.
That's amazing. So while all of this is going on, Aaron, um, are you continuing music? Is it something that you practice at home? Do you still play gigs? Is it something that informs your daily decisions? Is there any part of it in your life that like, okay, this is it. Music is here, this is there, or is it integrated?
I mean, I'm always listening for sure. I don't practice, but I kind of play like 2 or 3 times a week for 20 minutes, 30 minutes. In terms of gigs, I haven't really, since residency started, I haven't really played any gigs, but in medical school I played a lot more. But yeah, man, I mean, it's jazz is basically at my core, for sure. Even when I'm like in the hospital, I still consider myself a jazz musician before a doctor, for sure. It came first. It's just like, yeah, jazz is like what did I not that I'm Cannibal Adderley, but what did you say that one time where it's like, it's not a state of mind, it's a fact of life, or something like that?
Maybe, yeah.
He said that like on a record, and I mean, I don't think I'm as hip as him, but like I definitely resonates with me that it's a fact of life. It's not just something that can be. It's a state of mind I go into. I'm always carrying it around at my core.
Absolutely. Yeah, I meant to ask you in the beginning, because like the first question I asked, my first interview was with Tanya Kalmanovich, and she's an educator, she's an academician, she's a violist, an improviser, this and that. I said, how would you describe yourself? Because like there's so many titles, she has a doctorate in psychology and this and that. But she said musician first, just musician, and then everything else is after that. You kind of feel the same way, or?
I couldn't agree more,
Very cool.
Yeah.
One thing I like to think about a lot in music and in medicine and in our healthcare, because I've been dealing with a lot of it. My mother's been dealing with some issues with her heart, actually. We have a nurse coming once or twice a week sometimes, and these people are so filled with empathy. And the musicians I meet nowadays throughout the world, no matter where I go, are filled with empathy towards each other, wanting to play together. I remember in the 80s, there's a lot of tension between different musical groups and different kinds of styles.
Okay.
But I felt that that's kind of dissolved away, where musicians and people in medicine are filled with empathy towards one another. Yet at the same time, politically, I see all this divisiveness and kind of anger towards one another. Uh, and I can't quite figure out why these professions are feeling so beautifully towards one another and kind of like opening up the doors, like a free jazz musician can hang out with a bebop musician, can hang out with a hip hop musician, or a medical person can deal with so many different, lifestyles and different problems. The empathy factor has grown so much there, but politically, the empathy level seems to have diminished more and more and more. Do you have any insights on this? Because I do not.
Yeah, I don't know, man. Like, it seems to me, I mean, that in general, I think you're right. I mean, I think about like the stay-at-home order or something. Now, are people like, despite that, most people are staying home, red or blue states, it doesn't matter. They show that, the cell phone data. And I'm like, oh, well, that's pretty empathetic. They're staying home because they don't want to spread the disease, or is it they just don't want to get the disease? I'm not sure which one it is, if it's selfish or selfless. But
Right.
why, the question, I guess, is why some people are able to break down that barrier and but politically we can't.
Yes.
Because I think in politics there's no language for that. In music we have a common language where we can appreciate, like 98% of musicians dig Stevie Wonder, like 102% of jazz musicians like Glenn Gould, or something like that.
Right.
It's something like we have there's something common about that we can get with, but
this is very true.
It's like we have jerseys and then the discourse is me against you, and it's just like somebody wants to win. I don't know why. That's all we have, winning and losing elections. Why not, like, this person got the most amount of votes, but understood what this other guy was saying and adopted some of their platform. I don't know, like, there's no negotiation really. I think it's
right.
I think it's like a lot of it's just language and people wanting to get a W.
I think that's really well put. Common language, because I see among the medical professionals and I see among musicians, there seems to be some kind of common language, or at least enough of a common language that you can understand each other. And maybe politically we just haven't risen to that occasion. We're going to wrap it up pretty soon, but getting back to your original letter that you wrote about things, what would you say to people? What would your wishes be over the next 6 months? What do you wish for people?
So I just wish that people, when everybody starts going out again, and I just wish that people realize that when a lot of these stay-at-home orders are lifted and they say, well, we now have the hospital capacity to handle a surge. I just wish people will realize what that really means. It means that, yes, there will be more cases. To me, when I hear that, it says, hey, there's more chances for the nurses, the respiratory therapists, the doctors, the cleaning staff, the admin to be exposed more. So yes, there's more room at the hospital. That means, come on in and expose us. I mean, we're going to treat you either way, but like we're under protected, and just because it was shown that we can, quote, flatten the curve and we can tolerate more cases in the hospital, there'll be more cases in the hospital. People work there, and so you're just depending on them to be there, and you will be. But maybe the idea is, the less you're exposed, the less we're exposed. And I would like people to realize that just because the hospital is there, doesn't mean that we need to go there and risk other people's lives because we're out, or whatever. We need to continue to be conservative about this, because the less we're exposed, the less I'm exposed.
Gotcha. Wise words. One last question about because as a musician and as somebody who's booked a lot of music and you're friends with a lot of musicians, as you may know, pretty much all our careers are on indefinite hold. I've been out
Yeah,
of work since March 1st. I had tours canceled, this, that, everything through the summer. I'm booked and some stuff in the fall that's iffy at best in Europe.
yeah.
I don't know if like there's a, you know, a recurrence of this, and are they going to let Americans fly to Europe? You know, like from the, you
Mm.
know, like, so I might be out of work for almost a year or more. Do you have any ideas about that? Like what it means to, like who's going to want to like, yeah, things can reopen. I agree, you know, eventually,
Yeah,
slowly, safely. But playing in like a small Williamsburg club, you know, in a sweaty little room where like there's 50 people packed in this tiny basement room and you're playing,
yeah,
you know, that might not be the first, you know, place people want to go to experience a good time and
sure.
catch a deadly disease. Do you think things are going to change in the jazz or, you know, the free jazz industry or improvised industry, because that might take a lot longer than most places to reopen?
I If they do change, I hope it's for the better. Um, but for them to resume, for that to resume back to where it was, or I think a couple things will have to happen. Obviously, the vaccine's a big one; it has to be widely distributed. It has to be first discovered. Secondly, I think there might be some hope with like immunity. You know, people who had the disease, and if they find out those antibodies work. But that's still it's still kind of a ways off. There might be
It's
a
a long
meeting
ways off, yeah.
talking about it. I don't know what to say about the music industry, because that's like one of the first things I thought about when I heard about the disease hitting big in New York, is what's going to happen to all my friends who are playing music. I'm not quite sure what the answer is with that, and I don't think the government's going to help that. They never. I mean, they're like, it's far
No,
for
I
them. It's
mean,
far down the ladder in a way.
the government's not really helping out. There's a few little grants, but there are private jazz organizations that are trying to do things and raise money, and
Yeah.
that's great. But that can't sustain all of us for that very long, for very long.
No.
Um, I've been very fortunate, or in a weird way, fortunate that I came here to help my mom because of her heart problem. She was in the hospital, and then suddenly this whole thing happened, and she needed me here, and luckily I can be here for her because like suddenly I have no work. So in a
Mhm.
way, it's been the plus. And then you know, but my life's on hold, and luckily I'm not paying out, you know, thousands and thousands of dollars just to like get by. But a lot of musicians aren't in that same situation as I am. I can stay at my mother's for now and help her out, and then get some you know, food on the table. It's okay.
Yeah.
Is there any recourse that you know of for people that, you know, are having trouble getting food on the table, for instance?
Any recourse?
Yeah, I mean, do you know of any organizations that are really helping in that, especially for musicians?
No, I honestly I don't know what kind of activism has been out there. I know I've talked to Randy a little bit about this. I've heard some things on like Facebook or you know in the internet, but
Right.
I don't know offhand. I think though, like when concerts do start to happen again, I think one
Hmm.
option would be having less people in the room and just charging more. You know, I think frankly, I think ticket sales for music in general, save like big venues, have been too low. You
Yeah.
know, I don't think $20 is a lot to pay for a live concert. I don't think that's. I think it should be more. I think, you know, like Blue Note prices should be charged nowadays for shows that like, you know, like a play. I'm not saying bar, but singling them out. But a room that size, maybe
No,
there'll be
no.
less people and you pay more. You know,
Yeah.
and it's just and we actually pay for what we're getting in a way. And even though
Yeah,
there's
that
less
makes
people,
absolute sense. I mean, I've been playing in New York City since the 80s, and the average cost of the ticket hasn't changed maybe more than 5%, to be brutally frank. Inflation, everything, a piece of meat costs like 500 times as much, but a jazz
Yeah.
ticket in a small club in New York, pretty much the same as it was in 1988. So
I
I
also
think you're
think
right.
like, I think some bars need to like, some venues need to realize that the cred they get from having music is more valuable than they probably have been. I know bars struggle too, having been a bar owner, but I think the cred they get from having a music and a band there is more than they realize. It's worth more than they realize, and so
Right.
that musicians probably, after all this, that should be like healthcare should be reconsidered as being the importance that it really is, because everyone's going to want to hear music, man, and this is proving it.
I think you're right. I think you're right.
But the immediate recourse, I have nothing to offer right now. I don't know. I'd have to look into that.
I don't think any of us do, but I think it would be great if we all thought about it and try to come up with like a think tank and come up with different ideas. Because what this pandemic has done in a lot of ways is shown a light on a lot of the weaknesses in our society. Whether it's healthcare or minorities getting hit harder, and musicians just kind of being shut out of the game completely.
Absolutely.
These are kind of things, and then people also realizing that we do need musicians, because suddenly they don't have access to it, So
Right.
it's shown a light in a lot of ways, so that we all have to kind of think about it together. With that being said, Aaron, I can't thank you enough for doing this interview.
No, man, thank you. It's been an honor for sure. That's
is
understated again.
This is my second interview, and I'd like to end each interview with just a little 1-minute improvisation. If you have your horn with you, or a horn.
Yeah, there's one here.
Let's do it. See if I can remember how to play. Can you hear me?
I can.
Okay. Let's do it.
All right.
Aaron Ali Shaikh, everybody, thank you for doing this today.
Hey, thanks, Matt. Thank you.
I'm sorry, during the improvisation, I couldn't quite hear you, so I hope that came out for our viewers. If it didn't,
This is like I said, this is hard. With the headphones, it's hard to hear everything. That's why I think we need to get back to the clubs as soon as we can, or you guys can.
I hope so too. I hope so too.